Save up to 50% on your medicine bills. Ask your doctor or pharmacist if Pharmacodynamics has a generic medicine that's suitable for you.
Panorama Mediclinic in Cape Town boasts a world-class cardiac unit with a team of brilliant cardiologists and cardiac surgeons who regularly perform common heart procedures. Dr. Joe Bodenstein explains the function of a pacemaker.
A pacemaker is essentially an electronic device that is implanted into a human body for a certain reason. It's a casing of stainless steel with a battery and some computer mechanisms in it that helps the heart to contract in a way that it should. Essentially, it's a gadget that has little portals here into which we can attach the leads.
Pacemakers are used to treat irregular heartbeat rhythms. One particular type of pacemaker will even restart the heart should it stop beating for a certain time.
Implanting a pacemaker is actually a very simple procedure. We don't refer to it as an operation. The patient is not put under general anesthesia. Essentially, the pacemaker is planted either on the left side or on the right-hand side, under the collarbone or the clavicle. An incision that is essentially about 5-6 centimeters long is made here. A pouch is created behind the fat layer. Access is gained to the veins that go to the heart. Through these veins, the leads are placed, through which the electrical current will then be conveyed. Once the leads are in a good position in the heart, the back of these leads are then inserted into the pacemaker. The whole device is then placed into the pouch. The skin layer is closed up so that when the pacemaker procedure is finished, essentially you'll just see a closed wound. It's a very simple procedure that essentially takes about 3/4 an hour, and the patient can be discharged the following day.
One often hears of doctors fitting a stent. These minuscule structures are capable of saving lives and can be implanted using non-invasive surgery. Dr. Andrew Murray explains this fantastic device and the unique procedure.
A stent is a device that we use in cardiology to open up an artery that's either narrowed or that's blocked. It's made of stainless steel or cobalt chromium alloy.
Stents are used to open bile ducts, the urethra, and even the esophagus. Coronary stents are implanted not through the chest, but rather through the groin.
The way that we deploy a stent is we first put in a sheath and a catheter so that we've got a connection from outside the body to the artery of the heart. Once we've got that, the first thing we then achieve is by pushing the wire through the catheter, which comes out at the top into the patient's artery. We then manipulate the wire by turning it from the outside into the artery that we want to dilate. Once that's achieved, we then take the balloon, we thread the balloon onto the guiding wire, and then we push the balloon through the catheter right across where the narrowing is present. We then take the indeflator, which is a pressure device, and blow the balloon up. Once the stent has been deployed, we then remove the balloon, remove the guide wire, close up where we've made the incision into the groin, and the stent is in the patient's artery of the heart.
Dr. Razeen Gopal trained in the UK to perform highly specialized electrophysiology procedures. There are only a handful of doctors and equipped labs in South Africa which are able to correct electrical abnormalities in the heart without major surgery.
There is a seamless flow of electricity through the heart, which forms the basis of every single cardiac contraction. When we have an abnormality in this electrical flow, in other words, the pathway is either blocked or alternatively is flowing through repetitively, then we can actually do a procedure which is called cardiac ablation, which then damages the tissue which contains the abnormal circuit.
For cardiac ablation procedures, the patient can be placed under local anesthetic and remain awake to answer questions if necessary.
Ablation is performed for abnormalities which exist within the upper chambers of the heart, which are called the atria, and those rhythm disturbances are called atrial fibrillation or atrial flutter or supraventricular tachycardias. More ominous, sinister and dangerous rhythms can happen within the lower chambers of the heart, which are called the ventricles, and this rhythm may then be referred to as a ventricular tachycardia. We may treat these rhythm abnormalities with both cardiac ablation, which is a form of energy which is applied to the abnormal tissue, either by way of heat energy or alternatively intense cold energy, which is referred to as cryoablation.
This fairly new procedure has had extremely high success rates worldwide. Additionally, patients are also not required to spend days recovering in hospital.
The benefits of electrophysiology are many. Predominantly it is that we can actually cure the patient and therefore offer them an excellent quality of life. And secondly to that, we can take them off medication, which in many cases has terrible and toxic long-term side effects.
Thanks to major advancements in technology, cardiac procedures are no longer as scary, traumatic or confusing as they once used to be.
Save up to 50% on your medicine bills. Ask your doctor or pharmacist if Pharmacodynamics has a generic medicine that's suitable for you.